Hey, this is Dr. Padda. I wanted to talk a little bit about what I see as a massive problem inside of medicine. We have a tremendous amount of burnout in our physicians, and I don't think that it's going to get any better. We need to come up with some solutions because I think we're facing a massive calamity in medicine. I'm talking to you through the lens of somebody who wrote articles right when COVID started. I published articles regarding COVID and what I expected would happen. And I think that a lot of those concepts are prescient. I ended up looking at this in a very specific way because my background is both in medicine and in business. And I wanted to see what I could do to help my colleagues. I've been in medicine for many years. So this isn't about me. This is about what I see and how can we help our physician colleagues. The issue is that in medicine, we went into it because we want to help people. We fundamentally believe that we can change the world. We fundamentally believe that what we do helps humanity. The problem is that even though we are trying to do our best, there's a lot of forces outside of us that are self-enriching. And that doesn't mean that money's a bad thing. It doesn't mean that people shouldn't get wealthy. But we never got a good education in medicine. And as in terms of business, we're really well educated on how to take care of complicated chronic disease processes and acute disease processes. But not many physicians have a true understanding of the dark forces that ride just under the water and how they manipulate us ever so slightly, incrementally. And they do it in such a way that we end up in deep trouble. What's happened over time is that physicians have not had really an adjustment in income. Even though practice cost of inflation has been going up, physician updates have been lagging significantly behind. And what's happened is that we're dying a very slow death. Our entire system is dying off, and we don't even realize it. And that's a big deal. If you compare us to people with good lobbies, hospitals, inpatient and outpatient, skilled nursing facilities who have excellent lobbies, they've kept up with inflation and gotten ahead. We haven't. Our costs have gone up, but our physician salaries have not. And that's a massive issue. And people are feeling stressed. They're feeling overworked and overburdened. And I'll kind of explain what's going on because it's not the same medicine that I practiced when I came out of medical school 25 years ago. Actual specialty income, just in 3 years, actually went down physically 8.2%. But if you look at inflation-adjusted income, that's gone down over 50% over the last 10 years. It's hard to imagine inflation-adjusted income going down 50%. That means that the dollar that you earn might still be the same dollar, but inflation-adjusted buys half of what it used to do 10 years ago. And at the same time as that's going on, there's something interesting. Actual inflation-adjusted healthcare expenditure has gone up 80%. Now hold on. How can physician income be going down, inflation-adjusted, and inflation-adjusted healthcare be going up? Let me explain. What's happened is that the number of administrators has dramatically increased. This is a very significant curve. This is huge. There are 3,800% increase in the number of administrators from where we started. And that's a massive change. For every one physician, we now have 10 administrators either in the insurance company or in the hospital. So you're the donkey pulling the cart with 10 administrators riding on the back because they're not practicing medicine. And that's how we make valuable things happen in medicine. It's the practice of medicine. It's performing the care that the patients need, and there's a transaction that occurs and somebody gets paid. These administrators need you to work because if you stop working, they got nobody because they themselves can't practice medicine. Now, they're going to do all kinds of interesting things. They've pushed EHR systems so they can control your behavior, so they can monitor and manage. That's the purpose of a electronic health record, so they can more quickly administer exactly what protocols you use and figure out ways to metrics to reward you so you keep pulling the donkey cart harder and faster. What's happened is physicians have not increased in their numbers. Now, even from the standpoint physicians that we have that are practicing, over 74 to 75% of the physicians now are currently working for either hospitals or corporate entities. So they're not having the time to spend with their patient, because if they spend that time, they're in trouble. If you look at other physician specialties other than primary care, it's pretty much across the board. More and more physicians are becoming more and more corporate owned and more hospital owned, and the private practice physicians are going by the wayside. We thought that value-based healthcare would be a panacea. We were all bought into the fact that if we did value-based healthcare, we would get paid more. Well, what's happened is there's a disconnect. Value-based healthcare has not improved our outcome. And what's in fact done is created even more burdens for the people that practice healthcare. The average provider tracks 57 different quality metrics, and some of them are subtly off. One quality metric wants you to have a blood pressure systolic less than 140. Another one is 130. One of them is the blood pressure less than 90. Another is less than 80. And all of these quality metrics have to be recorded and tracked, and then your reimbursement is based upon these. So the problem is that physicians are getting massively burned out. They don't know which way to turn. Their income is going down, and they're being pushed and marginalized to the point where there's not many of them that are left. And eventually what's going to end up happening is that we're going to lose a big chunk of physicians. I believe in the next 10 years or less, we're going to be so shortfalled in the number of physician providers and nurse practitioners and physician assistants, all of the providers that have NPI numbers that we need to function in medicine, that we're going to have a massive issue. It's going to create a point of inflection where people get really upset. Now, the thing is, there's a way out of this. The reason why our healthcare system has become so burdensome is because we missed something. What we did was we focused in on the things that we were told we were to do, but we ignored the things that probably have massive impact. 2/3 of healthcare expenditure, $1.3 trillion a year, is primarily spent on things that are of metabolic health. And the thing is, metabolic health can be improved without expensive medication. It can be improved without putting patients in the hospital. And if we did that, we could save 2/3 of healthcare expenditure, and then we could go back to really practicing medicine. So that's how we ended up creating Measura. It's a protocol that we do to manage healthcare issues associated with lifestyle and to manage metabolic health specifically, putting the power of management back in the hands of the physician. It's not an easy thing to do, but fortunately, it does work, and it works extremely well. If you follow the current medical protocols for metabolic health, your chances of success with a patient is about 1 chance in 167 to 1 chance in 254. If you follow our protocols, your chances of success is 8 out of 10. And that means that we're not even playing in the same game. That means that we're using a totally different approach to metabolic health than what has been traditionally taught. Our approach avoids hospitalization. Our approach reduces medication or deprescription. That's what we spend most of our time doing in Measura. So if you're interested, reach out to me. We can chat and I can give you a lot more information. The whole point of this conversation was just to explain why physicians feel so much burnout. It's not because they're soft. It's not because they're not smart enough. They were incredibly smart. That's how they got to where they were. And they were incredibly tough. And they went through misery and back to be able to take care of their patients. It's not because they're not altruistic. But the problem is that they're getting taken advantage of. And that we need to fix. If you can, reach out to me. I'd be happy to chat. And if you have any questions, I'm always there. Thank you.